Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic, no snapping, no cracking, no popping, and practitioner of functional medicine. So most of the time on this show, I talk about functional medicine, how to use more comprehensive and progressive testing to identify conditions that other doctors miss. If you have someone that you know and love that's not getting the help that they think they should be getting, or the results, especially that they think they should be getting, then I'd love an opportunity to try and help them. If that person who's not getting the results they expect, if they don't need to go to the hospital immediately, then there's a good chance that I can help them. We talk about all kinds of different conditions on this show that functional medicine can help, that I've successfully helped over the years, 30 plus years in practice. And all of the previous episodes of this show are available as podcasts on my website, binkleyhealingcenter.com. You can also subscribe to the show on Apple Podcasts or on Spotify, on YouTube, and on all of those places there is a transcript of the show. If you want to read, or you didn't hear something, or you wanted to review something quickly, you can see the written text for each show transcribed. So today, the subject of today's show is toxins, and how toxins affect your health, increase your risk of certain diseases. And while I'm on that subject, I also am doing a live presentation in the office every week in downtown Ventura, the first Wednesday of every month, on various topics. And the next one coming up, the first Wednesday of November, which I believe is November 5th, on toxins and how they affect different conditions. So who do you know perhaps that has an unexplained rash? This is something that comes up a lot. People that have rashes and nothing else, and nothing seems to help get rid of them, especially just doing steroids. It's the most common medical therapy, which often doesn't work. There's usually a toxic exposure there. In my experience, I've helped people with really, really horrible rashes that were eliminated after we identified specific toxins that have built up and got their body to safely and effectively flush those things out. Your skin is an organ of elimination. And so if it's having trouble flushing something out, a rash is often the result. But also persistent autoimmune conditions like rheumatoid arthritis, Hashimoto's, low thyroid, lupus, multiple sclerosis, all of these autoimmune conditions are much more likely to occur and often are worse. The symptoms expressed by them are often worse if you have a significant body burden of various toxins. And then, they also increase your risk of certain types of cancers. So if you have a family history of certain cancers, or if exposure in your work, if you worked around industrial chemicals or around farms, or even if you didn't work on the farm, but you lived near fields and your windows are open and they're spraying chemicals on those fields, that can increase your risk of all these things. And the stress that chemicals and other toxins, heavy metals, impose on your immune system, it's a challenge. So if you have a body burden of these chemicals and other toxins, it stresses your immune system, and it can make it more difficult for you to fight off many conditions, especially many cancers. And most doctors just don't test for toxic exposure. So at best, they'll do blood tests if you have a known exposure, and this is the least important type of test for most toxins. Now, if you have an acute exposure to mercury or arsenic or glyphosate, which is one of the most common pesticides, or other pesticides, benzene, other industrial chemicals, these things will show up on a blood test if you've recently been exposed to a lot of them. But your body's really good at flushing these things out as best it can. And so when it does that, one of the ways it does that is it pulls things out of circulation, so it's not continually exposing every cell in your body to this chemical over and over and over again. What it can't flush out through the kidneys and colon, it will shove into fat cells just to get it out of circulation. So that's a defense mechanism to try and reduce the exposure of the rest of your body to this stuff that is unable to eliminate. But the downside is that ends up stored in your fat cells forever. And, most people don't get testing for these things because they're usually totally unaware of when they're exposed to them. Often, if you get an acute exposure to something at work or from, a spill or something like that, then it's obvious and you'll get tested. But if you're not, most people are just, have low grade exposure to these things over years, decades even. And the symptoms usually don't show up from a long-term chronic exposure till many, many years later. So even if you've suspected toxins and gone and had blood tests for various things, and they've told you that you're fine, that is not necessarily true, because as a protective mechanism, your body shoves these things into fat cells, and then they'll still be stored there indefinitely, forever. But you can identify that body burden mainly doing urine tests. So most of the tests for chemical toxins, for mold toxins, heavy metals are urine tests. And heavy metals can also be tested with a hair test, just like they test for drugs, for employee drug tests. With the hair test, you can also measure heavy metals in a hair test. So when you identify your body burden of these things, which is essential because everyone is different, everyone's exposure to these things is different, your genetic ability to excrete those things, even if you, independent of the exposure, varies, and whether or not you're getting the nutrients you need to effectively excrete them varies tremendously from one person to the next. So that's why it's so important to test, to see what you're dealing with, and then you can take some steps to flush these things out safely and effectively. You don't want to flush them out. If you hear about people that have done these weekend cleanses, I'm going to do a liver detox or some other kind of cleanse, that some mix that you drink and don't eat, or do a kind of a fast. Some of those things can be dangerous, because if you pull things out of storage too fast, then it'll make you sick. And whenever you're pulling these things out of fat cells, you're pulling them into circulation, and you want to get that out. You want to flush those things out through the kidneys and colon as quickly as possible. So if you have no idea what your body burden is, and you do one of these cleanses sort of at random without testing, then you can make yourself sick. So nobody wants that. But when you do it properly, slowly and effectively, identify your body burden, what you're exposed to, what your body is storing, safely and effectively excrete those things with some binding agents and some antioxidants and some other things that effectively help your kidneys and colon escort those things out. And then you retest months later to make sure you're on the right track. So you may wonder, well, how do I know if I need to get a test for various toxins? How do you know that that should be a priority for you or not? Well, I recommend that anyone with the conditions that I mentioned earlier, an autoimmune condition, but even if you just have risk factors for certain cancers, or if you know you've been exposed to something over the years, the only way to tell is to be tested. But there's a specific example. A 32-year-old male came to me, a few years ago, with dizziness, brain fog, debilitating fatigue, runny nose, cough, nausea, soft stools, and insomnia. So that's a lot of symptoms. He was really miserable, but he looked perfectly healthy. Looked like a perfectly healthy, fit 32-year-old man. And over the previous 7 months before he came to me, he'd been to the ER 5 times. He'd seen 3 ear, nose, and throat specialists, and a neurologist, and a cardiologist. And as he explained it, for 7 months now, I wake up every morning, have to sit on the edge of the bed for 20 to 30 minutes and wait till my head stops spinning. It feels like I'm drunk, but I don't drink. Then I go to work, but I have half the energy that I should have and constantly feel like I'm about to throw up. So immediately I asked him, I said, what kind of work do you do? Are you exposed to chemicals now? Or if you have any history of being exposed to chemicals? And he says, no, I'm the manager. I'm mostly just at my desk or out in the field sometimes, talking to a team of people. So I'm thinking, well, brain, something wrong with his brain that's causing the dizziness, or inner ear. Both of those things can cause dizziness and sinus symptoms. Is there something directly wrong with his sinuses? Is there something wrong with his gut? And I did a bunch of tests for all of these things, and they showed mainly minor abnormalities. So I again questioned, are you sure that you never have any history of exposure to toxic chemicals? And then he finally said, well, yes, actually, when I was a teenager, I worked in the fields and sprayed chemical pesticides and fertilizers on crops, frequently for years. So people don't realize that this stuff gets stored up in your body for years. Another common one is people will say, I said, do you have any exposure to mold? Have you ever noticed mold in your house, or any house you've ever lived in? They think about their current house and no exposure to mold. And then they would come back and they remember later, oh yeah, when I was in college, I lived in this place. And when we moved out and got all the boxes out and saw this whole really moldy wall that was really gross. Well, when you're exposed to something like that, it builds up in your system. And often the times those toxins are still stored in your fat cells and can be identified with a urine test. So it makes a huge difference to identify these things and flush them out. For this example, for this man with all these symptoms, He identified the things that he had just off the charts: exposure to glyphosate and a few other chemical pesticides and fertilizers. So I gave him some nutrients to help flush those things out, and some other things just for general health to make sure he was getting adequate amounts of vitamin D and omega-3 fatty acids, protein, and micronutrients, minerals. Most people are deficient in minerals. So just a basic program plus some extra stuff to help his body flush out the toxins. And 3 months later, his dizziness and disequilibrium were minimal or occasional. That's that thing where he woke up every morning, 20, 30 minutes, he'd have to sit on the edge of the bed, wait for his head to stop spinning. 3 months later, still had it, wasn't completely gone, but it was minimal. It was much, much improved. He was very happy about that. The brain fog that he had was gone. His fatigue that was, making it very difficult for him to work, 50% of what he used to have, that was half gone. He still had it. It's about, it was another 50% improvement. His runny nose and his cough were almost gone. His soft stools were, instead of every day, we're down to once a week now. And he's sleeping much better. So fast forward another 3 months, 6 months after we started, he says, I feel like a normal human being again. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. If you just tuned in, we're talking about toxins today, how various heavy metals and chemicals and mold toxins can affect various aspects of health, make it more difficult for your immune system to fight off certain conditions, and how it can increase your risk of certain cancers, and a whole host of other things. But before I'm going to come back to that and talk about toxins some more. But before I do that, since it is Breast Cancer Awareness Month, there is another really interesting study that came out in the literature about invasive lobular carcinoma. So this is invasive meaning bad, basically. Cancer of the lobes of the breast, which is different. It's much more common to have breast cancer in the ducts than in the lobes. But this invasive lobular cancer now accounts for 1 in every 10 breast cancers in the U.S. and is increasing at more than triple the rate of other breast cancers. So this is a report from the American Cancer Society. And the lobes are the milk-producing parts of the breast. And cancer of the ducts that carry the milk to the nipple are much more common. And in 2025, an estimated 33,600 women will be diagnosed with this lobular cancer of the lungs. And it also has the unique characteristics that makes it difficult to detect, which can contribute to delays in diagnosis, because it has more of a linear dispersed pattern. So instead of forming a lump typical of other breast cancers, it's more in a line or a dispersed pattern spread out, which makes it more difficult to detect clinically on a mammogram. And it can also have different symptoms, atypical symptoms like nipple inversion or skin thickening or dimpling. That's why it's important to always check for those things, as well as checking for, most women know if you're doing self-exams. If you don't know, and if you're not doing self-exams, all women should do a self-exam of their breasts at least once a month. So pick a day, the 1st of the month, the 15th, the end of the month, whenever. You can do it in the shower. If you're not sure how to do it properly and comprehensively, go on YouTube or just search for it on the internet. There's plenty of tutorials out there so you can make sure you're doing it correctly. This is obvious. This is one reason to be remind yourself that in addition to feeling for lumps, you also want to check for things like dimpling of the skin, thickening of the skin, or changes in the shape or color of the nipple, because that can indicate these other types of cancer. So incidence of this lobular cancer of the breast has more than doubled over the past half century, growing from about 6 per 100,000 women in 1975 to 14 per 100,000 women in 2021. And more importantly, the biggest rise is in the more recent years. From 2012 to 21, the rates increased by 3% per year compared to only 8.8, less than 1% for other breast cancers. So because it's more difficult to identify than other cancers, and the incidence of it is growing at 3 times the rate of other cancers. It's really important to know about this. This type of cancer also has a greater likelihood of spreading to the GI tract, to the stomach and the intestines, as well as the urinary tract lining and the ovaries, compared to the more common ductal carcinoma, meaning cancer of the ducts that carry milk to the nipple. This type of cancer is also less responsive to neoadjuvant chemotherapy, which is where they give you chemotherapy before. If you're a candidate for surgery, they'll do this type of chemotherapy to shrink the tumor before the surgery. It has a higher risk of involving both breasts, and it's a higher risk of a late recurrence. So you get a favorable outcome, but then it's more likely to recur later in life. And it also has a greater risk of being in both breasts from the outset. And this increased risk of lobular cancer of the breast is similar in women of all ages and all racial and ethnic groups. And the rising rates, like those of other breast cancers, are believed to be driven by risk factors such as obesity, younger age when you have the first menstrual cycle, later age of having a first child, if any, and later age of starting menopause, as well as increased alcohol consumption. So these are all known increased factors that increase your risk of any breast cancer. Well, this is important to know about, of course, and this month everyone's out running, raising money for more research, reminding people to get their mammograms, funding mammograms for people that need that, have difficulty getting that. And that's all great, but when this month, October, Breast Cancer Awareness Month comes around every year, I'm always wondering why more focus isn't put on educating people on how they can reduce their risk of getting breast cancer in the first place. Wouldn't that be a good idea? I think so. And there's many, many ways anybody, any woman, and men get breast cancer too. There's many ways you can reduce your risk of getting breast cancer or any other cancer. For example, you can just take better care of your overall health. If you do all the things that most people already know about to take better care of your health, you reduce exercise, eating good food, reducing stress, getting adequate sleep, etc. You can reduce your risk. There's good studies that show you can reduce your risk of most cancers just by doing those things, taking better care of your overall health. You can also specifically optimize your immune system function. One of the simplest ways to do that is get tested for vitamin D. Make sure your vitamin D level in your blood is between 50 and 90. Most doctors will order that test for you now, and they'll tell you it's fine if it's above 30. Well, that's enough to prevent your bones from collapsing. But it's going to still leave you at increased susceptibility to osteoporosis, and it's especially not even going to come close to getting your immune system to function at its peak. And there's lots of other ways to test your immune system function and make sure you're getting the things your body needs for your immune system to function optimally. That will also reduce your risk of getting severe colds and flus and a whole host of other things. And then you can also do specific tests that measure your current cancer-fighting activity. If you've ever heard that you're fighting off, even when the moment you're born, your body is fighting off cancer-causing cells. That doesn't mean you have cancer. It just means you have cells that have mutated and can potentially cause a cancer, and your body identifies those. Your immune system identifies those and destroys them like little Pac-Man. It gobbles them up and eliminates them. So there's specific types of cancer-fighting activity that can be identified, certain enzymes that show up and break down products that show up in your blood. Some of these tests are called things like cancer antigen 2729, cancer antigen 15.3, cancer antigen 19.9, and cancer antigen CA 125. Also CEA, carcinoembryonic antigen. This test is most famously known for risk of colon cancer, but it can be increased on certain types of breast cancer. And also AFP, alpha fetoprotein. So that's a lot of words, a lot of numbers. Doesn't really matter to remember all of that. But the important thing is these are tests that oncologists use to see if your cancer is coming back. You can't diagnose cancer with these blood tests yet. They're working on blood tests that will identify certain types of cancers earlier. But right now, for decades, oncologists have been using these inexpensive blood tests. They're around $30 each. And the 5 that I mentioned, $170 give or take for all 5. You can do these if you have risk factors. If you had a mother or an aunt or a sister or a grandmother that had breast cancer, then obviously your risk is going to be increased. And if you have any of the other things that I've talked about earlier, for if you just want to be, on the safe side, anybody can get these tests done to see if you have increased cancer-fighting activity consistent with potential breast cancer right now. So again, this doesn't diagnose breast cancer. I always tell anybody that orders these, you got to promise you're not going to freak out if these numbers are a little elevated, because if they're a little elevated, that doesn't mean anything. There's other things that can cause these numbers to be elevated when you have no cancer at all. But there's always almost always a certain amount of these things. The normal range for some of them is 0, but a lot of them, the expected range is more than 0. There's usually some of these things present in your bloodstream all the time. But if it's out of range, if it's out of the medical range, or even if it's out of the narrower functional range, if it's higher than normal, then oncologists don't do those before you've been diagnosed from some kind of a scan, because they're not going to give you chemotherapy or do surgery or give you any kind of standard cancer treatment just because these numbers are up a little bit. They wait until you don't get a cancer diagnosis until you can see a tumor on a scan, on a mammogram, on an x-ray, on an MRI, on a CAT scan, on a PET scan. You have to, or an ultrasound. You have to identify an unusual mass on a scan and then biopsy and test those cells and look at them under a microscope. Then you know exactly what you're dealing with, and then it's worth the risks and other potential nightmares of going through standard cancer treatment. But you can use these tests to see if your body is fighting off more cancer-causing cells right now, and you're not going to take drugs for that, but you can take certain nutrients. You can optimize your immune system function. You can make sure that your vitamin D is up. You can make sure that you're getting all the nutrients your body needs to heal and repair itself with a comprehensive functional testing analysis. You can take better care of your overall health, and then you can retest a few months later and make sure those numbers are going down. I do this all the time with certain patients. I'm not treating their cancer. I'm not necessarily guaranteeing that they're preventing the cancer, but it's a way to reduce your risk. Those are the words you want to think about. You can identify risk factors and do something to reduce your risk of getting breast cancer in the first place. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. The theme of today's presentation is toxins, how you can identify whether or not your body is exposed to certain toxins and safely eliminate them. And then I did a little bit of a divergence on a specific type of breast cancer that's becoming more and more prevalent, and things that you can do to reduce your risk of any type of cancer. We're going to get back to toxins now, but before I do that, I want to remind everyone that I am doing a series of talks in my office now in downtown Ventura. I call it Live at Binkley Healing Center. Last month we talked about reducing your risk of breast cancer. This coming month, November 5th, the first Wednesday of November, I'll be talking about toxins. Everything we're talking about on this show today, I'll go into more specifics of that case of the 32-year-old man that came to me with horrible, debilitating dizziness and fatigue, and what we did to help him get back to feeling totally fine again. And so that'll be November 5th, first Wednesday of the month, 6 p.m. I'll have some light refreshments and then questions and answer afterwards. So even though we'll be talking about toxins specifically, I welcome your questions. It would be nice to meet you face to face and hear your questions about any health related topic, whether it's toxins or reducing risk of breast cancer, helping deal with the side effects of cancer treatment. These are all things that can be done with better food, exercise, and supplements. So the brain is the most sensitive organ in the body to any kind of nutrient deficiency and any exposure or body burden of toxins. And so it's not surprising then that when people have a lot of buildup of toxins, or they're exposed to a lot of toxic chemicals and unable to flush those things out, that it's going to affect the brain. And one of the ways that shows up is Parkinson's disease. It looks like we're not going to have time to talk about this week, so I'll talk about that next week. But what we're going to be talking about then is there's some great studies that just came out on how Parkinson's risk increases with outdoor air chemical exposure to trichloroethylene, a common chemical used in degreasing and dry cleaning, is correlated with a higher risk of Parkinson's disease. Now, what does that mean? This means it's not somebody that was degreasing, working in the military or in some other industry where they're degreasing the machinery with the stuff and getting it on their hands or breathing it directly in the workplace. No, these are just people that were breathing the air around places, a certain distance from these places, and having a 10% or more increased risk of Parkinson's. We'll talk more about that next week. As always, thank you for tuning in. Send me your questions, what you'd like to hear me talk about next week. Have a fabulous weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for Safe, Effective Natural Solutions here on 98.3 FM, The Word.